Okay, so there are a few ways that you can get affected of anthrax. The first one is the skin, open lesions. It's called cutaneous. And then we have the lungs inhalation, which happened after 9/11. And then we have the digestive, the gastrointestinal. Anthrax is not known to spread from person to person. Mainly, it goes through livestock that is affected, and it can be consumed through humans. Like I said earlier, anthrax can become a spore, and it can be dormant when its conditions are not in its favor. But once it's consumed, whether it's a human host or an animal host, that's when it becomes active. Here are some more characteristics of the Bacillus anthracis. A low GNC gram-positive, as you can see here, has a thick peptoglycan-coated cell walls. It's surrounded by a spore coat. Low toxigenicity and highly invasive. Produces endospores. And I said this earlier, but the dormancy can last more than 1,000 years. Some of the symptoms that come along with inhalation of anthrax can include fever, chills, chest discomfort, shortness or dizziness of breath, cough, nausea, vomiting, stomach pains, headaches, sweats. But if you see here, this is also a symptom of anthrax. This is a raise. It can also be itchy bump resembling an insect bite that quickly develops into a painless sore with a black center. So this one's a little bit severe. Swelling in the sore and nearby lymph glands, sometimes flu-like symptoms, including fever and headache. So when we talk about treatment, if you go through the cutaneous route, which is through the skin, and you don't want treatment, 20% of your chance is that you're gonna die. But with proper treatment, and you go through the cutaneous route of receiving anthrax, you're most likely to survive. Now let's just say we have inhalation. Without treatment, about 10 to 15% of patients survive. However, with aggressive treatment, about 55% of patients survive. This is one of the treatments here, ciprofloxacin. This is the main medication used when treating anthrax. Another treatment is doxycycline. And then the third would be levofloxacin. These are all going to be antibiotics. And so lastly, I leave you with these questions. For Bacillus anthracis, it thrives in the proper conditions. Mild temperature, plenty of moisture, nutrients to feast on. Why do you think Bacillus anthracis can live so long without the proper conditions? And my second question would be, why is the antibiotic